Hi, this is Dr. Duresti with the Cranial Release Technique, back with another video. My wife and I moved back to New York City, and I'm happy to announce that I'm going back into practice here in Queens, in Jackson Heights, as a matter of fact. And I'll leave all the details down below. But the reason why I wanted to make this video is because I've been getting quite a few questions, and I wanted to explain some things about the Cranial Release Technique. Things that maybe some of you know and some of you don't. So let's just do a simple review. Here's a plastic model of a human brain. This is about the right size, 3 pounds. This is the master controller, the computer of the body. This controls everything that you're aware of and not aware of. How well you interact with other people, how well you digest your food, how well your immune system functions, how well you can work a computer, how well your memory's working, how well your immune system's working, how well you move your body in space. Everything that makes you you is under the control of the brain, or what's called the central nervous system. There are 22 bones that cover and protect the brain. That's called the skull, okay? And we know some people have thicker skulls than others, but that's for another lecture. The problem is that these bones in the head can shift and misalign, and the reason why there are 22 bones is because those bones are constantly moving. Very gently, almost on a microscopic level, those 22 bones keep moving, or sort of breathing, if you will. When those bones shift out of their normal position, that breathing mechanism is reduced. Okay, so now you're saying to yourself, well, what does that even mean? How would I know if I have a cranial that's a cranium, or these cranial bones that are misaligned? Well, there's a pretty simple, easy way to tell, and you can do it yourself today. All you have to do is look in a mirror. And if you look in a mirror and look at your eyes, you're going to ask yourself a question. Does one eye look lower than the other in the head, the right versus the left? Does one eye look smaller, right versus left? Does one ear look lower, right versus left? Does one ear look more forward or more back, right versus left? Do you see distortion at the cheeks? Do you see distortion in the jaw? Maybe with the way you speak or when you watch someone else speak. Cranial distortion is everywhere, and the more you look for it, the more you're going to see it. So now people are walking around with this cranial distortion, and that right there tells me that there's no way that the brain or the central nervous system is optimized. It's impossible. Instead of those bones protecting the brain, those bones are now putting tension on the brain. And this is how you're going through life. And it doesn't necessarily show up as tension in the brain because you can't feel that. It could show up as things like headaches, could show up as a skin problem, could show up as a digestive issue, could show up as an immune disorder, could show up as a musculoskeletal problem, some issue with the body. The point of cranial release and the cranial release technique is we don't address the symptoms that you come in with. We address one concept, which is I want to optimize function at the brain, at the central nervous system level. If we can optimize function here, everything else in the body will function better, including your ability to relate to other people, your ability to sell a product or a service that you do for a living, your ability to be a parent, your ability to learn a new language, your ability to do dance. Everything about what makes you you will be optimized when we address the cranium and optimize central nervous system function. So, I have a little slide here that I usually use with my patients and with my students that I teach, and I'm going to hold it up here, and hopefully you're going to see that pretty good. And we call this the CRT choice, and I'll bring it in just a bit more, because if you've never seen this little slide or not, all of you would say, well, if I had a choice, I'd rather be the person in the middle. When you're in the middle, the brain hemispheres are balanced, the body's in balance, The body's structurally balanced. You're healing, repairing, regenerating. Your body is constantly rebuilding itself. It's constantly in a state of ease, and you're handling stress as you go throughout the day. In my experience, when you come and visit me or you visit any cranial release practitioner, you'll probably walk in and you'll be figure number 1 or number 3, which means that one of the brain hemispheres is actually overactive and one side is underactive. That will cause distortion throughout the body, and then there's no way that you possibly could function optimally. So I named this slide the CRT choice because regardless of if you come in as number 1 or number 3, you want to be in the middle, and in the middle is where the fun is. That's where the body is constantly repairing itself. All systems are being optimized. And again, it comes back to, are these cranial bones distorted? And if you come in and receive cranial release, we're going to start to align the bones and then restore this normal respiratory or breathing mechanism of the bones. And that's the purpose of cranial release technique. So it doesn't matter if you're watching this and you feel great. You say, well, I don't need cranial release. Trust me, if you came in to see me or another cranial release practitioner, you're probably figure number 1 or figure number 3. And that tells me that you are not functioning optimally. Optimal function is that middle structure. Brain is balanced, body is balanced, everything's in order, and everything is maximized. And that's the point of the cranial release technique. So I'm going to leave the details down below. If you have any questions for me, if you'd like to come and visit me personally, great. If you'd like to see someone else in your area, again, I'm in New York City. If you're in California, I'm a little far to get to. So cranialrelease.com is the website. And we hope to see you soon. And I'll be making some more videos to explain this at a deeper level. But let's just start very general and very easy. The brain controls the body. The cranium protects the brain. The cranial bones can shift out of alignment. Go look in the mirror, look at the eyes, look at the ears, look at the face. You'll see the cranial distortion. The cranial release technique balances the cranium, takes tension off the brain, and optimizes your function at every level. That's the cranial release technique. This is Dr. DeResti saying thanks so much for watching. See you down the road, and I hope you have a great day. Thank you. Goodbye.